Good evening to all the viewers who are watching live and will be watching on the recorded version. This is me, Orko Mukherjee, with you all. And sorry for this much delay. We were facing some technical issues while joining our panel members. And since from the start who are there with us from the starting, they know that we do go through with lots of technical issues, but we cope up with it. And again, we have wasted like 18 minutes. So before starting, let me just tell a few things. Like from 8:30 onwards, the e-participation certificate link will be on for this CME, and that will last till 12 a.m. Not 12 a.m. properly. It will last till today. It will close on 11:59 p.m. sharp. So after the link starts, after the link opens, do make sure to just click on that and get your e-participation certificate as soon as possible, because it's very much important. So without wasting any more time, and also on the backstage, we finally have, let me just in short, we have a full panel members. We were waiting for our moderator ma'am, and she has also entered now. So, without wasting any more time, let's just start today's CME with the 30 seconds countdown time.
Good evening, all viewers. Good evening, sir.
Good
In spite
evening.
of a lot of technical snags, we have been able to continue with the 131st episode of the online CME. And after a happy new year to all, and we are on the 131st episode. We are trying to continue with this process, but uh, in last few episodes we had been facing challenges with a lot of technical issues. Moreover, due to some unavoidable circumstances, our speakers to change the speakers at the last hour has been a great challenge for all of us, and we are thankful to our alumni network, the senior alumni who are responsible enough to come forward and help the alumni association to continue with the CME. So tonight we are going on with a very excellent topic. And sir, with your permission, let us call on the inaugurator tonight, Dr. Siddhartha Pal.
Sure, please call him.
Over to you. Stage is all yours, Dr. Siddhartha.
Thank you, sir. Respected dignitaries, esteemed speaker and moderator, senior faculty member, dear colleagues, and participating joining us online, a very good evening to one and all. Myself, Dr. Siddhartha Pal, an alumnus of the National Institute of Homoeopathy, 19th batch PGT, Department of Organon of Medicine. I am currently working as Assistant Research Officer at NIH, Kolkata. It is my pleasure to welcome you to the 131st CME program being held today on the topic acute diseases in theory and practice, and a sound understanding of the theory along with practical application is essential for effective patient cure. We are privileged to have with us as today's speaker Professor Dr. Arijit Chowdhury, a distinguished academician and clinician whose concept and vast experience are widely appreciated. We are confident his session will be highly enriching. I also extend a warm welcome to our moderator, Professor Dr. Ompriya Mishra, whose guidance will ensure a focused and interactive academic discussion. Such seminar provide an excellent platform to exchange knowledge, strengthen concept, and bridges theory with practice. I hope today's deliberation will be insightful, interactive, and academically enriching for all participants. Once again, I welcome you all and wish the seminar every success. Thank you. And the mic handed over to the moderator, ma'am, Dr. Ompriya Mishra, ma'am.
Maybe from technical issues. Nah, Ompriya ma'am is here. Over to you, Ompriya ma'am.
Hello.
Ma'am, you are audible. Please turn on the camera if possible. There is technical snag, so let's just move on to our speaker. Okay, sir. Arijit, sir, the stage is yours, sir.
Good evening, everybody. To our respected President of NIH Alumni Associations, our General Secretary, Dr. Bidyut Mukherjee, my co-members, Dr. Ompriya Mishra, Dr. Siddhartha, and also Dr. Mukherjee. We are very much thankful to all the members of the NIH Alumni Associations for making such a platform for interactions on different academic topics to enrich ourselves. However, my today's topic is acute diseases in theory and practice. Actually, we all are clinicians. Oftentimes, we practice with confidence, but what Hahnemann the Hahnemannian concept of acute diseases were really a boon to the medical fraternity because 200 years back, what Hahnemann just philosophically made a platform for defining diseases in different aspects. It's really an unthinkable matter. And today, the modern medicines in many areas oftentimes just made some elaborations of different aspects of the diseases. But if we just tally the excerpts of the Hahnemann and also those of the modern medicines, there are so many similarities. Yes. Today's topic is acute disease. So it's a common myth which is oftentimes runs in mouth to mouth of the patients and also in the general public that homeopathy is useful in chronic diseases. Homeopathy is useful in children. But in reality, those actually we practice in our clinics and also who are practicing in the OPDs, we know that thousands and thousands of acute diseases are dealt every day. So homeopathy, in reality, useful in acute diseases and acute conditions. Actually, whenever we talk about the acute diseases, a portion of it also becomes necessarily parallel to it, that is the acute conditions. Though it has certain limitations, we must admit. And also homeopathy is also useful in adults too. There are so many definitions. We know that in acute disease, what Hahnemann described in Organon of Medicine is the acute disease are rapid morbid processes of the dynamically deranged vital force, which have a tendency to finish their course more or less quickly, but always in a moderate time. This was the actual phrase expressed by Hahnemann. But what modern medicine states, a disease of abrupt onset, of short duration, rapidly progressing, and in need of urgent care. Quantifications of duration varies with the diseases. So, hence, the term acute disease is used qualitatively in contrast with the subacute and chronic. So, acute is a measure of the time scale. So, when there is a abrupt onset, short duration, this is the time scale, a measure of the time scale. In contrast to the subacute and chronic one, subacute indicates longer durations and chronic indicates an indefinite durations. In modern medicines, acute often connotes the two meanings, sudden onset and also severity. That is also stated as the acute conditions, acute diseases, like acute leukemia, myocardial infarctions, acute renal failure, all of the, by means of severity, they becomes acute. And in homeopathy, besides acute diseases, there is another set of conditions known as the acute exacerbation of the chronic disease. These are the acute state which develops not as an acute disease, but acute conditions of the chronic disease. So modern medicine termed this state as the acute on chronic. Pathologically, another terminology is in vogue, that is the acute on chronic inflammations, which includes the asthma, rheumatoid arthritis, chronic peptic ulcers, and so on, so on. I'm not going into the details of the aphorisms, but there are typically, in 73 of the Organon of Medicines, we have seen that there are three different types of the acute diseases: individual acute disease, sporadic acute disease, and epidemic acute disease. But whenever we see that exciting causes lies behind the febrile affections, there are certain causes are there, but in reality, these acute diseases develop from the transient explosion of the latent sora. But whenever we talk about the acute diseases, we mostly concerned with the acute diseases which involves the physic. But the psyche at the same time is equally touched by the disease. So it is not only regarding the physical diseases, but the psychological or emotional diseases also falls under the acute diseases, which has been stated separately in the Organon of Medicines by Hahnemann. Another sets of diseases are the sporadic and epidemic acute diseases. So I'm not going into the details of definitions, but epidemic acute diseases, the diseases become infectious when they occur among the thickly congregated masses of human beings. Another is the febrile affections of peculiar nature. There are certain causes and producers of the epidemic acute diseases. I'm not going into the details because it's the Organon of Medicines, everything is written in clearly. Now, what modern medicine says, the concept of epidemic disease encompasses certain factors: rapid spread, affects large number of populations, occurs at a rate much higher than typically expected in, and not necessarily contagious, because nowadays the concept of epidemic disease also encompasses obesity, diabetes, etc. Because in United States, the obesity is described as an epidemic, and also the diabetes also. So previous description of epidemic presumes only infectious diseases, but nowadays the non-infectious diseases like diabetes and obesity exist in epidemic proportion in the US. According to the modern concept, the epidemic diseases, a recent increase in amount or virulence of the agent, Number 2, a recent introduction of an agent into a setting where it has not been before. Number 3, an enhanced mode of transmission so that more susceptible persons are exposed. Number 4, a change in the susceptibility of the host response to the agent. And finally, factors increasing the host exposure or involve introductions through new portal of entry. These are the certain parameters which have been fixed by the modern medicine to describe the epidemic diseases. Another disease known as the endemic disease, which usually remains in a particular geographical area in a certain number. And when this number exceeds what is expected for that particular region, then the endemic disease may become an epidemic one. Hahnemann, in his Organ of Medicines and also in the chronic disease, has clearly stated that endemic intermittent fevers attack the individual who enjoyed a good health on their first arrival. These patients can be cured with 1 or 2 small doses of the highly potentized synchronopod, that means China, along with well-regulated mode of living. But it should be kept in mind, this is not all. And this is not the end of the story. Because if we don't use or just forget to use the potentized Syncona followed by antibiotic treatment, then there are chances of recurrence of the disease. Is there any harm if fixed name is given to a disease and fixed mode of treatment? Actually, Hahnemann was not against the diagnosis of the disease, but he was against the treating a name of by the name of the disease. Treating a disease by the name is erroneous, according to the Hahnemannian concept, because we know whatever it may be, whether it's a scarlet fever, whether it's a measles, whether it's a mumps, whatever it may be, when it attacks several individuals at one time in a single go, there are different types of expression depending upon the individuality of the case. So if we just stamp the disease and try to treat the disease according to the name of the disease, then we will be at fault, because the individuality factor, which is the key point of the homeopathic prescribing, will be lost. So diagnosis is necessary, because without diagnosis, we cannot just go forward with the prognosis, the other management of the disease, the fate of the disease, the natural history of the disease, everything will be at loss. So here lies the danger of providing a fixed name to a disease and to treat them with a fixed method. That's why later on, he urged the people, if at all a name is to be given, then it should be given as a kind of that particular disease. Say, for example, if there are scarlet fever, we should diagnose the disease as a kind of the scarlet fever, not the scarlet fever itself. Because if we just stamp the disease as a scarlet fever or stamp the disease as mumps and try to treat with a particular medicine, then we will be at fault. Besides Hahnemann, some other contemporary or the following followers of the Hahnemann or other from the modern medicines also were of the same view, that fixed names of the disease ought to have least importance on the practice of true physicians to judge and to cure diseases like Haxam, Frizze, Sidenum, all were there. So, but in present day context, owing to the new rules and regulations laid down by the NCH, it becomes necessary to identify the disease by name, that is the diagnosis of the disease, and to mention the ICD code of the diseases, both for the acute and chronic diseases. So it becomes compulsory for a physician to diagnose the disease to name the disease by its nosological name and to mention the ICD code, because we are not guided by the organon of medicines. Just if we follow the organon of medicines, which were written 200 years back, in present day context, the rules and regulations doesn't allow us to do actually to go for that. So we have to definitely obey the rules and regulations laid out by the National Commissions of Homeopathy and the other governing bodies of the homeopathy. Modern medicine defines the infectious disease, a clinical manifest disease of man or animals resulting from an infections. Communicable disease is something different, an illness due to specific infectious agent or its toxic products capable of being directly or indirectly from man to man, animal to animal, or from environment to man or animal. And epidemic diseases, the unusual occurrence of a disease in a community or region clearly in excess of an expected occurrence. This is the very, very important. Clearly in excess of an expected occurrence. So in the diseases which are not at all endemic in a particular regions, or there is no history of any occurrence for last few years, a single or a few disease, if occurs in a particular geographical area, that can be termed as an epidemic one, because it is in excess of the expected frequency. So expected occurrence is very, very important. In USA, a single case of cholera may be termed as epidemic, whereas in India or Bangladesh, hundreds of cases to be occurred to be considered as epidemic. This is very, very important because it is the term we have to remember that it should be in excess of the usual occurrence. Endemic means constant presence of disease or an infectious agent within a given geographical area or population group without importations from outside. It also refers to the usual or expected frequency of a disease within such an area or population group, that is common cold, hepatitis A, typhoid, etc. Under favorable circumstances, an endemic disease may become epidemic one when the number of diseases in that particular geographical area or in a community is in excess of the expected occurrences. And sporadic means scattered about. Here and there, certain cases are always remain. Say, for example, cough and colds or some other viral infections, etc. Say, for example, the cases are so few and separated widely from each other that they show little or no connection with each other or have any common source of infections. Polio is still occurring in India. Tetanus is also occurring now and then. Herpes zoster, oftentimes we met in the clinics. Meningococcal meningitis, etc. Sometimes a sporadic disease may be the starting point for an epidemic under favorable circumstances. So it's very interesting. An epidemic disease may develop either from the endemic or from the sporadic. That may be a starting point, and ultimately, when it becomes a rapid spread into the involving the more and more populations in a particular geographical area or in a community, then it may become an epidemic one. There are certain terms, pandemic, exotic, zoonosis. I am not going into the details. Today, modern medicine explains the dynamics of disease transmission by three distinct parts. And here, there is a very similarity with that of the Hahnemannian concept. The source or reservoir of the disease. Number two is the modes of transmissions, and number three is the susceptible host. This chain of disease dynamics is very similar to homeopathic philosophy of disease. In susceptible host, there occurs some phenomena which results in disease. And this involves successful parasitism, that is the consists of portal of entry, site of elections, and portal of exit. Number 2 is the incubation period. In non-communicable diseases, this period is termed as the latent period, which is equivalent to the incubation period of the infectious disease. Number 3 is the serial interval, the gap time between the onset of the primary case and the secondary case. And number 4 is the generation time. It is the interval between the receipt of the infections and maximum infectivity by that host. So these are the different natures of the acute diseases. So far, the theory is concerned. In practically, when we actually treat or deal with the acute patients in the clinics or in the OPDs, we oftentimes do not just classify the disease according to our theory. We just follow the symptoms, make the totality, and treat them. But besides this, we have to keep in mind certain factors which usually is related with the rules and regulations laid down by the governing authorities of the homeopathy. There are certain government rules and regulations in general to the medical fraternity. So, for example, there are so many diseases, particularly acute diseases, which are notifiable in character. But it is the duty of the physician, particularly in relation to the acute diseases, it is the duty of the physician to notify to the concerned authority. Because a notifiable disease is always pose a threat for the society, for the community concerned. So it is the duty of the physician to notify the disease to the concerned authority, maybe to the municipal corporations, maybe to the certain nodal officers of the government in certain areas, maybe to the primary health center, whatever it may be, as the case may be. However, notifiable disease should be notified to the concerned authority. So these are the rules and regulations we should follow in clinical practice. However, Hahnemann in his chronic diseases has described the origin and development of the chronic as well as acute miasmatic eruptional diseases. So this is another vital. That is the acute miasmatic eruptional diseases. He mentioned 3 different important moments: the time of infections, the period of time during which the whole organism is being penetrated by the disease, infused until it has developed within, and the breaking out of the external ailment. Actually, these are the concepts which developed 200 years back. But today, modern medicines also describes in a more moderate form. That is successful parasitism, incubation period, serial interval, and generation time. And these are the views of the modern medicine. But this was the view as per the homeopathic philosophy, or it is the concept in the written down in the organ of medicines and as well as in the chronic disease. The time of infections, the period of time during the whole organism is being penetrated, that is the incubation period. The breaking out of the external ailment. For all acute miasmatic diseases, the human constitution possesses the beneficent process to wipe out the specific fever with specific eruptions, either by crisis or by lysis. Actually, that in the course of 2 or 3 weeks, through a kind of decision, that is the crisis from the organism, so that the entirely healed or of them unless he be killed by them. So either the organism is killed or the individual. This is the main, we say, the theme of the acute diseases. In epidemiological studies, incubation period is of fundamental importance. There are different types of incubation period. There may be short incubation period, there may be medium incubation period. And this incubation period is very, very important because oftentimes it is seen that the source of infection or from where the infection has started to spread is very, very relevant for the treatment, not only for the patient, but also for the community or the family concerned. Is very, very important. During incubation period, we can prevent the clinical illness by use of the effective antisera or human immunoglobulins, etc. Sometimes the incubation period helps in determining the prognosis of the disease. In general, shorter the incubation period, worse the prognosis of the disease, though there may be some exceptions. Now, how to acquire the knowledge of acute disease? How is the physician to ascertain what is necessary to be known in order to cure the disease? So there are certain criteria of the physicians. In short, what we call case taking. Hahnemann termed that particular case taking as individualized examination of a case of disease. In the aphorism 83, it has been clearly written what is case taking. The criteria for the physicians are definitely, it's applicable to all and everybody. Freedom from prejudice, sound senses, attention in observing, and fidelity in tracing the picture of the disease. Now, during individualist examinations, there are certain factors which oftentimes helps to reach the goal. That is the individualized case can be, that is the for individualizations. We may need the follow certain things to be known. That is the exciting cause of the disease, his occupations, his moral and intellectual character, mode of living and habits, social and domestic relations, age, sexual functions, everything. These are the accessory circumstances. And here, the word of the Winston Churchill is very, very important in medical parlance. The further back you look, the further forward you can see. So this is more relevant with the chronic disease or case taking in relations with the individualized examinations of the case. But it is also, we cannot ignore this particular term or phrase in acute disease too. Now, in clinics or in OPDs, different types of acute disease may come to us, but how they represent or how, from where they visit the clinic or the OPD, they may be a fresh case. Patient who has already received self-medications. Patient who has been treated by another homeopathic physician. Patient who has been treated by physicians of modern medicine. Acute exacerbation of the chronic disease. A chronic case may be affected and superadded by an acute disease. So these are the more or less different types of cases that we met in our clinical practice. So when the case comes fresh, it's comparatively very easier to deal those cases. But when there are self-medications or they come from other homeopathic physicians or physicians of the modern medicines, it becomes really very difficult to treat or to manage those cases because, with due respect to all the homeopathic physicians, it has been observed that in many cases, prescription is not served. I'm not criticizing anybody, but it is our difficulty that we are discussing. So it's very, we are at a loss that what kind of medicine he has taken, he or she has taken. We don't know and there is no scope of knowing this. Oftentimes, we have no case history at all. What was there, and now what he or she is presenting to me. So there are no clinical notes in the prescriptions. These are the difficulties that we face. In case of the modern medicine practitioners, they oftentimes administer several antipyretics or antibiotics or antiviral medicines, and the original disease oftentimes gets mixed with all the symptomatology of the antibiotics or antiviral and so on, so on. So these are the difficulties that we face in day-to-day practice when the cases, particularly the acute cases, visit in our clinic. The physician sees, hears, and remarks by his other senses what there is of an altered or unusual character about him. Yes, this is written in the organ of medicines, but there is another hurdle that we oftentimes face. Say, a patient oftentimes is very reluctant to visit the clinics. His parents or her parents oftentimes come and say, "Doctor, my son or my daughter has such and such type of problems. Please give me some help." But it becomes very, very difficult for the homeopathic physicians in particular, because the physician cannot see, cannot hear, or can, with other senses, cannot inspect the patient at all, because whatever description is provided by the parents may not be what is needed, or may not be in exact elaborations of the sufferings. Hahnemann warned us that we should take our, or we should hear the patient's own description, patient's own elaborations, because in the mouth of the relatives or in the friends, they're oftentimes erroneously described or described in too vivid colors. The physician takes note of nothing in every individual case except the changes in the health of the body and mind. But this portion is really almost impossible when the patient himself or herself doesn't visit the chamber, rather her teens or her parents visit the chamber. In a diseased individual, the psyche and the physic are either sides of a single coin. So we have to judge both the physical symptoms as well as his emotions, his attitude, his mental conditions. But when the patient himself or herself is not being present in the clinic or in front of the physician, really it's a very difficult part to judge them. It's really a pure guesswork. Individualized examination of the case is not only writing down the symptomatology, but there are another factor, that is the non-verbal communications, which the patient himself communicates to the physicians. His or her attitude, way of talking, hurriedness or slowness, his facial countenance, everything to be judged. And these play a very, very important role in making the individuality of the patient. But when the patient himself or herself is lacking in the chamber, it's very, very difficult to get these non-verbal communications from the patient side. So it's the duty of the physicians to notice the deviations from the former healthy state to the diseased individual. Here are 3 points. The changes to be observed with the patient himself, that are to be remarked by those around him, and observed by the physician. But when the patient himself or herself is not visiting the clinic, the first and the third point is lacking. So the individualizations may not be perfect. We have to rely chiefly on the descriptions of the patient. In the aphorism 89 and 98, this has been already clearly described in the Organon of Medicines that except in the feigned diseases, we must rely on the descriptions of the patient of his sensations and sufferings and feelings, etc. And this is done because in the mouths of his friends and attendants, they are usually altered or erroneously stated. This is very, very important, very, very important. We all the clinicians know, not only in the acute disease, but also in the chronic disease, the same thing we oftentimes face in the chamber. So the non-verbal communications is missing here. In case of the acute disease, another thing we have to just keep in mind that when the patient himself or herself visits the chamber, we have to just take note of everything, but we have to inquire much less because the patient spontaneously describes everything. Because all these events have arisen within a very short spell. So everything is fresh in the memory and the patient can vividly describe them. The physician. In diseases of rapid course or serious character and which admits no delay, we must content ourselves by observing the morbid conditions, even if it is altered by previous medications. If true original picture is not ascertainable, take account of the conjoint malady. And this is done to save the patient so that he might not fall sacrifice to the injurious drugs he has swallowed. These are the certain prerequisite qualifications of the physicians, definitely. You all know this. I've already stated this, that the investigation of the acute disease is much easier for the physician because all the phenomena and deviations from the health are still fresh in the memory of the patient. Obvious cause. This is very, very important thing in case of the acute diseases. In case of acute, also in the chronic disease, definitely, the patient or his friends may mention some obvious cause of the diseases either spontaneously or when questioned privately. Because obvious causes are often a matter of shy or out of certain social stigma. They oftentimes doesn't disclose it spontaneously. So when questioned privately, they may declare it of their own. Certain, say for example, some attempted suicide, certain poisonings, onanisms, certain debauchery activities, certain involvement or indulgement in the wine or other cordials or punch, or having some particular type of food or hurtful character, some misfortunes, certain worry, grief, etc., etc., and so many, even the imperfections of the private parts. Often the patients doesn't disclose in front of the parents to the physicians. So when questioned privately, they may disclose it. Now, till now, we were mostly concerned regarding the diseases of the physique. But I have already stated that the disease or the problems of the physique and the psyche are just like the either sides of a single coin. Because most of the diseases touches both the sphere, the physical as well as the mental sphere. Animal, in his organ of medicines as well as in the chronic diseases, nicely stated that it is not only about the physical diseases, but mental diseases also have some acute expressions. So acute diseases also maybe of mental variety. Some cases of the insanity or mania may suddenly break out as an acute disease. They may be caused by fright, vexations, or even abuse of the spirituous liquors. Although almost always it arises from the internal sora, at the first instance it should be treated by the other class approved medicines. That is the germ medicines like aconite, belladonna, hyoscyamus, stramonium, mercury, etc. But the patient should never be treated as cured until an antisoric treatment is done. The attacks of the mania or insanity may break forth again and again in the later days with much slighter cause if it is not treated with the antisoric. So it remains subdued or in some slumbered conditions. So when the antisoric is given, as per the homeopathic philosophy, the chances of the recurrence are much less or almost nil. Hahnemann, in his writings, significantly described the different types of the auxiliary management and asked to treat those acute mania with certain conditions. We oftentimes talk about some counseling of the patient where medication is a secondary, but counseling of the patient may become primary. So this type of counseling or the auxiliary management, that is the psychological management of the patient, is very, very important in treating the acute mental diseases. The calm intrepidity and cool, firm resolutions to doleful, querulous lamentations. This is a very, very important thing. A mute display of the commiserations in looks and gestures to senseless chattering. Just to ignore when a patient is chattering senselessly. When he is carrying out some abominable or disgusting conduct, a silence is the word, not wholly inattentive. We must be very, very watchful, but we keep ourselves silent, just observe the patient. And also, we must advise the family members, the parents and other family members, to be in the same line. When there are disgusting conversations, total inattention to be given. But it should be kept in mind, everything must be arranged to prevent any destructions and injury to the surrounding objects. And we must not go for any corporeal punishment. Oftentimes it is seen that the mental diseases or the acute mental conditions or even manias are treated with some corporeal punishments. But Hahnemann was deadly against this. He urged the medical fraternity not to go for any corporeal punishment. Exception is that for administration of the homeopathic medicines. For administration of the medicines, you can compel the patient or coercion may be allowed. Otherwise, Hahnemann was deadly against the corporeal punishment or tortures of the patients, not to reproach the patients for his acts. So, these are actually these physical diseases and psychological diseases are all together constitute the holistic approach of the homeopathy also in the acute diseases. So these are not the separate entities. Oftentimes it is seen that physical diseases are associated with certain mental factors, and the mental diseases are also associated with certain physical conditions. And these are to be dealt simultaneously. It is not like that the physical disease should be dealt by some physicians and mental disease should be dealt by some other. That should be treated by a single physician, making a holistic approach. He also urged the physicians In case of the epidemic and sporadic diseases, it is immaterial whether the similar diseases has ever appeared in the past or not, under the same or a different name, whatever it may be. Each and every epidemic should be treated as a new one, as a fresh one, an unknown one. And that should be investigated thoroughly to get the picture of that particular epidemic. He should never consider the disease before him as wholly or partially known. The only exception is the epidemics where contagious principle always remains the same, such as measles, smallpox, etc. We know that when the measles breaks forth or the smallpox breaks forth, actually, chicken pox is there, smallpox are extinct from the continent. However, they usually recur with the fixed and unvarying character. These are the how to take up the case in case of the epidemic disease. I am not going into the detail. However, this is very important. This is found in the Hahnemannian writings as well as this type of complex diseases are also found in the modern literatures. While discussing the complex disease formations by dissimilar acute diseases, Hahnemann put forward examples where measles and smallpox are prevalent at the same time and both attack the same child. One may suspend the other and run his course till the latter one completes its course. Similarly, cowpox, measles, and mumps cowpox are also seen to occur in the same individual. This is very, very complicated presentation of the acute diseases. Smallpox, measles, cowpox, measles, purpura, cowpox, syphilis, etc. Now, the modern medicines. It has been noted that sometimes chickenpox and measles may occur together, and most remarkable finding is that in case of a double infection, the first infection may diminish the severity of the rash of the second infections. And this particular statement, it was published in the Alta Milton 1976 Lancet. However, this statement is nothing but the re-echoing of the Hahnemannian statement. You can see. So, the homeopathic philosophy, which was described 200 years back, was not a vague descriptions. His philosophical ideologies, his foresights were much more stronger than anyone else. And his thought processes are, we are getting the echoing of the thought process in the modern medicines too. Management of the acute disease. This is also very important because we oftentimes forget what to do and what not to do. Do's and don'ts, we oftentimes prescribe in a general manner to the patient. But here are the definitive directions given by the Hahnemann in the theoretical part. Everything having medicinal virtue must be removed from the diet and regimen, which usually doesn't deserve the effects of the small dose, so that the medicine is not overwhelmed and extinguished by the foreign medicinal irritant. So, in case of the diet and regimen, in nowadays, it's really very, very difficult to give such an advice to the patient because the footnotes of the Hahnemannian aphorisms oftentimes given a list of varied or varying substances which are not to be taken along with the medicines. But in reality, in practical life, it is oftentimes very difficult for the patient. If we just ask the patient not to take all these things, the next question that he faces, then what should I eat? Everything is not to be taken. So what to be taken? It's really a matter of concern. So that should be kept in mind that as far as practicable, we should abolish those things from the diet and regimen. But one thing that is also mentioned by the Hahnemann, the last paragraph, the stricter form of regimen and diet are more important for treatment of the chronic disease. They are also not to be disregarded in the treatment of the acute disease. But in acute diseases, there are some relaxations. What type of relaxations? In acute disease, the distress vital principle of the patient often urgently desires some sort of food and drink, which give the patient a kind of palliative relief. Here, the friends and attendants must not refuse or try to persuade him to partake of anything injurious, because the gratification of patient's desire within moderate bounds may cause slight hindrances in the way of radical removal of the disease. This opposing action will be counteracted and overcome by the power of the homeopathically chosen remedy and vital force. And the refreshment that the patient feels following intaking of, say for example, when the patient is having some sore throat or dysphagia, but he or she is desiring cold water, within moderate bounds we can allow them, because the refreshment that follows from taking the substances ardently longed for. It has been observed that in such a state of the patient, the desires for these things are usually of non-medicinal in nature. Action of aconitum napellus is destroyed by partaking of vegetable acids, but the patient of aconite desires only for pure cold water, not for the vegetable acids. In like manner, the room temperatures, heat and coolness of the bed coverings may be arranged for the comfort of the patient. In acute individual diseases, the exciting causes which acts as injurious influences to be avoided, whether in the forms of the environment or in the form of the food and drink. Coffee has got mental as well as the systemic physiological effects, as we all know. So these are altogether the acute disease in theory, which has been described by the Hahnemann in organ of medicine as well as in the chronic diseases. Now, I will show some cured acute diseases, not only the acute disease, but some acute conditions also. Some treated cases. Infective gingivitis with facial cellulitis. Just see the patient. The cheek is swollen and just the gums and teeth are very, very painful. And there is a bag-like puffy swelling under the left eyelid. There is a puffiness of the whole face. Even the forehead is also swollen. The left side of the forehead you can see. The nose is tense, swollen. So there is a development of the cellulitis from this infective gingivitis. He was 62 years, came with a swelling of the left side of the face for just 2 days. He visited on the 15/11/19. On examinations, gum near the left lower premolar and molar swollen, congested, tense, tender on external pressure. Foul odor from the mouth was emitting. Left side swollen, bag-like swelling under the left eye, puffiness of face. Provisional diagnosis of a cellulitis developed following infective gingivitis. Now, just have a look of the picture after 4 days. It was in 1511, and now it is in 1911. The swelling has gone, the pain and sensitivity of the jaw has gone, the appearance already changed. The left side of the face, the tenseness of the nose, the swelling of the forehead, everything gone. The prescription was Marxol 30, 12 doses, TDS for 4 days. He was advised warm saline mouthwash 3 to 4 times daily, and the basis of prescription was nocturnal aggravations, moist, dirty, indented, with much thirst, offensive smell emitting from the mouth, and no ameliorations from either heat or cold applications. On examinations, the swelling was not so tender, rather firm. The cervical glands, submandibular glands on left side were swollen and tender. So, if the remedy is chosen properly, definitely homeopathy can bring out the result within a very short span of time. Usually, when the facial cellulitis develops, we are very worried about that because it also involves the danger area of the face, and the infections may rapidly spread to the brain, cerebrum, through the cavernous sinuses. So in that case, within 3 days, the patient was recovered. Now, traumatic hematoma of the face. This is not the disease proper. Definitely, it was a result of the injury. The patient, 76 years old lady, and received the injury following a fall on the ground by slipping, and received major injury over face, and the injury all over 2 days back. On examination, swelling and tenderness over the right periorbital regions. You can just see the swelling of the periorbital regions of the forehead, supraorbital ridges or supraorbital areas, and hematoma of the around the eyes. Swelling and tenderness over the right periorbital regions, vision normal, eyeball tender, conjunctiva congested. Planicity of the brain and X-ray curl was advised. Now, you can see after the treatment started, the color change has started. The hematoma around the eyes has started to be reduced. Congestion of the conjunctiva is still there. Blood has accumulated under the eye, but the swelling and tenseness is reduced. And pain around the orbit or orbital bones are markedly reduced. It took about 12 days to recover from the hematoma. And you can see the congestions of the conjunctiva has gone. The hematoma around the eyes almost gone. A little bit of trace is there under the right eye. The swelling is reduced. There is no pain. So, if the medicine acts properly, according to the law of similia, sorry, it may just bring about a havoc. Definitely, the prescription was Arnica montana. The prescription was Arnica montana, 212 doses, TDS for 4 days. Later on, she was given OD for another 4 days with rubrum and TDS for 6 days. The basis of prescription was the simple, the injury medicines as we prescribe, history of fall, the blunt injury, sore bruise feeling all over the body, extravasation of the blood into the conjunctiva and skin. The patient did not complain much about her injury. So this shows the homeopathic medicines is also applicable in acute conditions. And if properly chosen, it can bring about the results. Now, in case of the herpes zoster, an old lady of 83 years. And as we all know, in case of the old age, as the immunity is comparatively slower than the younger ages, definitely these infections, particularly these herpes and other infections, oftentimes doesn't yield properly to the medicines, and it takes several days to be cured. However, came to me after 4 days of the appearance of the vesicular and pustular eruptions with severe pain and burning. Initially went to the allopathic physicians, but after 3 days of medication, having no marked improvement, came to me. You can see the vesicles have started to dry up. It was on 25th, and now the features see on 28th after 3 days. On the 2nd September, the vesicles are still drying up. But as the herpes zoster was attacked in the eye, not in the conjunctiva, but in the lids. So the right eye is almost semi-closed. Only discomfort was a sense of the dryness and tenseness feeling over the face because the eruptions were drying up. Once the pain and burning were relieved, the anxiety and fear of the patient was much reduced. The patient was non-diabetic. Now the eruptions have started to heal up. On 7th of the September, no pain, no burning. There was blurring of the vision as conjunctiva was affected by the herpetic eruptions with secondary infections. Pustules started to heal. On the 11th, most of the eruptions about the face have gone and dried up. Conjunctiva is still affected. Now, the eruptions is very, very dry. The vision also much improved. Now you can see on the 20th of September, the eruptions completely healed. Even there was no marked residual skin mark of the herpes zoster. So in an old lady of 83 years, I am grateful to that particular patient because she actually put faith on the homeopathy. Actually, she was averse of taking the allopathic medicines. The bitter pills were very, very bitter in reality to her. And that's why he switched over to the homeopathy, because she, for the last 20 years, was on homeopathic medications. So, here also, if homeopathic medicines are given in according to the individuality, it may bring about the havoc results. In this case, my prescription was arsenic and alum in repeated doses with external dressings with echinacea mother in lukewarm water. Initially, arsenic was given in TDS for 5 days, followed by BD for 4 days, followed by OD for 3 days. And thereafter, 5 times of 200 BD to continue. Simultaneously, dressing was continued with echinacea mother. The basis of prescription was vesicopostular rashes with burning pain relieved by hot applications. Patient was fearfully anxious about our elements, even feared death. Thirsty, but drinks frequently, yet little at a time. Mentally restless, but physically very prostrated. I am thankful as she had faith on homeopathy and she was ultimately recovered with homeopathy. Now a case of the tarsal cyst. Though tarsal cyst is a more or less chronic conditions, but here there are some acute exacerbations on chronic. A part of the acute conditions that we have already described during our theoretical explanations, that there are certain cases where there are acute exacerbation of the chronic conditions. So here you can see she had been suffering for 5 months, but for last few days become very painful. Eye surgeon asked her to operate. After general management and antibiotics, cyst gradually developed to the present size. She is unwilling to operate. She came to me on 27/10/11 for opinion. It was an acute exacerbation on chronic. On 10/11/18, the cyst much improved. Slight pain under the lid. It was 27/10. After 2 weeks, just have a look. Another 7 days. The cyst almost gone. Much improved, only scarred tissue remains and no complaint at all. So, though it was initially the tarsal cyst was a chronic one, but there are some acute exacerbations with pain and swelling when the eye surgeon asked her to go for the knife. But she didn't, and ultimately came to me for my advice, and she was cured within 3 weeks of time. Now, the prescription was, it was only Calcirac of 200, 2 doses, OD for 2 days. It was a cystic tumor, characteristic sweating of the head, more during sleep, wetting the pillow, craving for eggs and ice creams, great susceptibility to cold. These are the very, very characteristics of the Calcirac curve, and the patient, actually, the identity of the patient, I should not disclose. Maybe many of us may recognize her, but as she is not without her specs, she is a public figure, however. So homeopathy saved the women from surgeon's knife, and it was the Calcirac of 200, only 2 doses, which cured the cases without having any incisions or any removal of the cystic mass. Molluscum contagiation. It also develops as an acute condition. It's a child of around 3 years of age. So you can see the pictures are not so clear, however, in this picture you can see, okay, there are certain marks are also on the chest. You can see this is a clear picture. After 2 weeks of treatment, the number of molluscum have reduced. The sizes are much smaller than before. You can see the molluscum is much fewer than before. Almost clear. There are no traces of any molluscum. On the forehead, there is only a pimple is there. So, no traces of the molluscum anywhere, and the pimple also gone over the forehead. So this is the case of a child. So homeopathy is effective in children. That is very, very true in this case. However, molluscum is a self-limiting disease also, but it takes about 6 to 9 months to resolve by its own. But it is here, it took only 2 months to get rid of that condition. So definitely medicine has worked or did its best to shorten the resolution of the molluscus, because usually in modern medicine books it has been written that it takes about 6 months to 9 months or more to resolve spontaneously. When it has occurred within 2 months, definitely the medicine has done its role. This was a case of the natramure. Initially, 2 doses of the 200 were given. Later on, almost after a month or 4 weeks interval, one dose were given, and thereafter no medicines were required, only Rugrams were continued. The main thing of our prescription was, the prescribing symptoms were craving for salt. And she's a daughter of my very known person, picks salts from the parents' dishes from the table. She used to eat the salts from the parents' dishes. His very anger and irritability is there, uses temper on and off. But if he wants to explain or just wants to calm her down or soothe her down, he becomes more angry and expresses her anger by she jumps out from the lap of the mother and sits on the floor like this. The more aggravated conditions. And when more the anger, more he weeps, more she weeps. Weeps easily, but especially when she is angry. And constipation. Stool very hard, dry, crumbling. So these are the features on which natramure were given. And natramure did its best to cure the case. Dengue fever. Before going into the case, one thing it should be kept in mind that in clinical practice, we oftentimes face that the patients are very reluctant to go for the blood test. When the patient comes to your chamber, he may describe that, "Oh, doctor, I have spent a lot about the investigations. I went to that particular doctor of modern medicines, there from there. I just move from like a shuttlecock from here to there and spend thousands and thousands of rupees in investigations. But when you prescribe simple investigations, they oftentimes are very much reluctant to do that. Moreover, when after just you want to see the before and after result, when you advise a follow-up investigations, the common answer that you get, I am relieved of my symptoms, then okay, I will do it later on. But that later never comes. It's a common practice. So the NS1 was 32.10 done on the third day of the fever. And there is a history of the dengue fever in the surrounding houses. So definitely there was a source of infections in the community. Fever with severe body ache, nausea, headache were the presenting symptoms. His platelet was 1.54 lakhs. And the patient came to me on 8/10/17. The IgM was done. It was 26.50. I just asked the patient to have plenty of fluid and water. And on that conditions, I took the patients that you have to go for the platelet count on a regular basis. Because most of the cases, it has been observed that after, when the fever subsides on the second day or third day, thereafter the platelet count reduces rapidly. And oftentimes, these are the most crisis period for the patient. So doing a platelet count on a regular basis is very, very an earmark for the dengue fever. So platelet count started improving because it was 1.5 lakh initially. Now it is 1.78 lakh after 2 days. Then after another 3 days, it springs to 3.1 lakh. Much increased. There was no fever, no body ache. The patient weakness is much reduced. The patient is much happier than before. It was a prescription of the Eupatria, 6 doses, BD for 3 days. After 2 days, the fever was gone, body ache was much reduced. Then the medicine was repeated once daily for another 3 days. The patient was advised plenty of water and other fluids. The basis of prescription was fever with severe body ache all over, including bones and muscles, bitter taste in the mouth with nausea, profuse thirst during fevers particularly. Eyeball was painfully tender and movement of the eyeball causes pain, headache, particularly in the occiput region with sense of heaviness. These are the prescribing symptoms, typically with that of like that of Eupatria perfluata. On 1510, patient was advised for dengue IgM, plenty of fluid and water. As the fever was gone and the platelet is written wrongly. Platelets was raised to 3.1 lakh. The patient was reluctant to go for the further test. On 2010, however, he was much better than before. No trace of any previous ailments. Weakness much improved, and he carried on his daily activities as before. So it was the Eupatria, another case of dengue fever. He is a very known public figure. He is a rugby player. The young man, male patient of 31 years, rugby player by profession and posted at Bhubaneswar. He had to travel in different parts of the country and abroad to participate in national and international games. The patient had high grade of fever for 3 days and underwent treatment in modern medicine with paracetamol at Bhubaneswar. The fever did not subside with the treatment, and blood test was advised by the concerned physician. Report showed he was positive for dengue IgM with high titer, and his platelet count was below the lower limit of normal values. Patient was scared and came back to Kolkata, his hometown, and visited me for advice. I assured him and prescribed blood report done on 2nd of November shows it's a clear-cut picture, lymphocytosis with relative neutropenia. His hemoglobin was 16.2, which indicates towards the hemo concentrations. RBC 5.47 million, TC 7,000. Platelet count was 140,000. That means 1.4 lakhs. It was decreasing. Blood report, dengue ELISA shows it was 42.1. It was highly positive on 2nd November. CRP was 1.56. The patient came to me on the 4th November. He had no fever as he had already took paracetamol 650 for 2 days. He had polyarthralgia, which was relieved by warm applications and warm bath. He had nausea, chilliness, profound weakness, thirsty but can't drink much, taking only sips. He was afraid of some complications of the disease, thought that he had COVID-19. I assured him that he had no COVID. Mentally and physically, he was very, very restless. I prescribed arsenic and album, 39 doses, TDS for 3 days, and advised for CBC and dengue IgM to repeat. Initially, dengue IgM was 42. After taking arsenic, the platelet count increased to 47,000. That means 2.47 lakhs. The neutropenia and lymphocytosis altered. Now it is neutrophil 47 and lymphocytes 37, monocytes 14. So the blood picture started changing. Serum dengue ELISA done. Dengue antibodies shows 5.79 unit from 42 to 5.79. ELISA reactive but much less than previous one. So when the patient was cured of his other symptoms and advised him for the follow-up blood test, the same thing happens. Oh, doctor, actually, I am free from all the symptoms. I am now okay. I can now carry on my job and also can run in my run in the field with rugby. So I will do it later on. So that is the common problem oftentimes we face in the clinical practice. But he was cured of that. A case of acute fever with breathing difficulty. Actually, this type of diagnosis is very, very vague one, I know. But it was the COVID period, the post-COVID period actually, after the lockdown phase. A 42 years female came with the complaints of fever with shortness of the breath for 3 days. Blood serology revealed that she had elevated CRP and IL-6, which indicates towards the COVID-19 positivity. I asked her to perform the RT-PCR, but in spite of the advice, the patient didn't perform the RT-PCR because it was actually a social stigma that if I get positive for the COVID-19, I will be isolated or I will be taken away to the hospitals. I will be separated from my family. I have my children in the house, so I don't want to get it done. So the patient was put on isolations with prescribed medicines and advised for vapor inhalations, warm saline gargle, nutritious diet, and bed rest. And I asked the patient not to allow her baby. Actually, it was not baby, rather child. He was then 4 or 5 years of age. Depending on the characteristic features, she was given arsenic, TDS for 4 days. SOB diminished, but some oppression persisted, fever subsided, weakness persisted, arsenic BD for 3 days, TDS for, Rubram BD for 3 days. Patient was advised to give daily feedback about patient. Patient improved a lot with continuation of general management and regimen, vapor inhalations and breathing exercise. Arsenic 202 doses were given later on 5/11. And after 6 days, patient improved a lot with continuation of general management and regimen. No shortness of the breath. General condition much improved. Prostrations much diminished. Patient was advised for follow-up CRP and IL-6. And on 19/11, CRP and IL-6 were found to be normal. On 30/10, his ESR was 25, CRP was 7.85, IL-6 was 7.01 picogram per milliliter. And after treatment, CRP was 2.93, IL-6 was 2.64 with a normal limit. As the patient did not carry out the RT-PCR for COVID-19, I cannot diagnose the case as a COVID one. This is one thing. Number two, at that time, COVID-19 was a notifiable disease, and as per the government laws laid down by then, we, the physicians of homeopathy, cannot treat the COVID-19 patients in our clinic because it should be treated by the modern medicines only. So we cannot diagnose this case or stamp this case as a COVID-19 one. That's why I made the diagnosis as a fever with shortness of the breath. So I guess, I might say that I guess, because as RT-PCR was not done, it was a case of the COVID positive. A case of the acute episcleritis. This is a very interesting case. A software engineer A female software engineer, aged 32 years, came to me with complaints of the red eye, mostly angular, near the inner canthi of the left eye. There was a gritty sensations and mild watering from the eyes. No pain or tenderness of eyeball. She has a prolonged screen time exposure. I examined the eyeball, but it was non-tender. I was confused regarding diagnosis and I advised her to consult an ophthalmologist. I gave the prescriptions and told them to consult ophthalmologist if the condition persists even after 3 days. I studied the case at the end of the day and provisionally diagnosed it as episcleritis. The prescription was argentum nitricum 204 doses, BD for 2 days. On 25th, the redness of the left eye completely disappeared. No pain, no grittiness. But since morning, a similar redness of inner canthi of the right eye developed. And that was also painless, but grittiness was there. I again asked them to see an ophthalmologist, but they insisted for homeopathy because as the left eye was gone by homeopathic treatment, so continue the treatment. I prescribed argentum nitricum, another dose, 2 doses, OD for 2 days. And Phytum, 8 doses, BD for 4 days. On 3rd March, that is the day 7th, the patient came back smiling. Both the eyes were clear, no sign of congestions, no grittiness. I prescribed sulfur as a Phytum and Phytum 200 to be taken at morning and evening respectively. Now see, the episcleritis of the left eye, which disappeared after 2 days. Then the right eye developed. You can see. Now this is on day 7, on the 3rd March. Both the eyes are clear. Should I continue? Actually, I think it's becoming boring for most of us. So, okay, this is an interesting case of acute contact dermatitis. A male patient aged 45 years came to me with an ugly looking skin eruptions in the right arm. He had a small furuncle in his right arm and he applied betadine cream. And after a few hours of applications, there was some irritations and itching. And ultimately, a ulcerative rash develops in the particular area of betadine applications. And it was very ugly looking. Gradually, there was sloughing ulcerations and charred appearance over the area. He feared that he had developed some malignant conditions due to rapidity of the process. The color and the appearance of the eruption was really a matter of great concern, and I asked him to discontinue the external betadine or any other applications. Advised to wash the area with lukewarm water and to keep it dry. Just have a look of the conditions. Some vesicles were there. After applications of the betadine, the skin becomes like this. After 7 days, you can see just a erythematous area here, but the rest of the areas are clear. And after 2 weeks, there was no trace of any eruptions on the right arm. So this was the uniqueness of the homeopathic pills. The prescription was Bovista 6 doses, BD for 3 days, along with repeated doses of the nihilinum. Externally dressings with calendula mother in lukewarm water was advised. Basis of prescription was contact dermatitis from use of the iodine, itching, superficial ulcerations with crust formations and little discharges, feels better by warm washings. On 17th, after 7 days, it was much my utter surprise that there was marked improvement of the condition, no ulcerations, no discharge, no itching, only a little erythematous zone at the site of the eruption. I prescribed Rubram for another 7 days. On 24th, the patient came back with bright eyes, no traces of eruptions in the arm. Acute facial paralysis. A female patient of 55 years, domestic help by profession, came with a complaint of headache with deviation of the angle of the mouth to left side for 2 days. Sensing the cerebrovascular accidents, I immediately advised for serum lipid profile and CT scan of the brain. She expressed inability to perform the test as it requires a lump sum amount, which is not possible for her. However, I admire her inaffordability. I explained the necessity of those tests, but she insisted to carry on the treatment. Her BP was raised to 170 by 100. I took up her history and prescribed with certain limitations of not having the CT brain and lipid profiles. This was the case. You can see the nasolabial groove is much less on the right side, and the labial furrow is also absent on the right side. It is prominent in the left side. The condition little bit improved, but still there are the absence of the nasolabial groove and the labial furrow on the right side. It was the day 8. On day 27, after 4 weeks, now you can see the nasolabial groove appeared on the right side, and the labial furrow also appeared on the right side of the face. On day 43, she was completely normal, without having any trace of any deviations of the mouth, and her BP came down to 128 by 70. The prescription was Costicam 200, 2 doses, OD for 2 days. The prescribing symptoms were calmness. The patient was very anxious, craving for salted food, desire cold food, takes her meal cold, does not like hot or warm food. Thirst is very poor, almost thirstlessness. Facial paralysis, one-sided paralysis, and corners of the mouth drawn to one side with drooling of saliva. I reporterized the case, and the result shows Costicam to top the list with all the aforesaid symptoms. I, without any hesitations, prescribed Costicam. Follow-up after 7 days. I have already just displayed the pictures of the lady, how she developed. And ultimately, the nasolabial group appeared, fold in the angle of the mouth, they appeared on the right side. So, fracture at the base of the proximal phalanx of right little finger. So, this is not in true sense a natural disease, but it's an accident met due to fall. And here is the fracture. Yes, you can see nicely the fracture over here. The arrow indicates the fracture site. It's clear. Yes, you can see here the fracture line. Fracture at the proximal phalanx of little finger. There is a history of fall on the ground, and she sustained an injury. Callus formation started. Here you can see the callus formation started over here and also over here. The callus formation started. Later on, the report shows old fracture seen at the base of the proximal phalanx of little finger. Evidence of the old fracture. There is no definitive fracture line is there. No fractured bone seen, no displacement. colors just covered the area. So this is the sites of the old fracture area. No definitive fracture. Here is the size of the old fractured area. The fracture healed. The prescription was definitely, as you can guess, it was the fracture remedy of the homeopathy, the symphytum. Initially, as she received the injury and there was a pain and swelling, I prescribed arnica for 2 days. And after receiving the X-ray, when there was a fracture, the proximal phalanx of the little finger was diagnosed. I shipped over to symphytum 206 doses, BT for 3 days to start with. The finger was put on finger splint. Follow-up done after 2 weeks. No pain, no swelling, no complaints. The case was followed after another 2 weeks. Almost no complaint, but a little tenderness over the fracture site. Symphytum was repeated, only 2 doses, OD for 2 days. The patient was advised contrast bath of the right hand. A follow-up X-ray of the right hand shows the patient turned up on 17/8 with the X-ray report. There was evidence of the old fracture, no pain, no tenderness. And no further medicine was prescribed, only opening and closing of the fist of right hand and contrast bath was advised. So, these are altogether the representations. There are so many slides up there, but I am not going to make you boring. There is a take-home message for today's seminar. Homeopathy can effectively manage the acute diseases and acute conditions, keeping in mind the limitations. Number 2, single medicines can be effectively used based on available totality of symptoms. And number 3, definitely this is the most important one. These presentations are not to glorify myself, rather to instill confidence in neophytes. Thank you very much, the NIH Alumni Associations, for providing me the time and platform for my deliberations. Thank you, everybody. Over to the studio.
Good evening. Dr. Orko is our moderator, Dr. Ompriya, in the studio.
No, she is joining right now. She was watching via YouTube due to network issues, and
Okay,
she is
okay.
joining right now.
Thank
Please
you.
be with
Thank
us.
you. Thank you, Dr. Arijit. It has been an excellent session. Orko, if possible, can you bring on Dr. Devnayan Kalyani, sir?
Thank you, Bidyut. Many thanks to Arijit. Many thanks. This CME will be an asset to the newers, obviously. Not 1, 2 cases, series of cases of different types and cured within a shortest period of time. We heard that homeopathy is slow working disease. Arijit has presented not only fast, but faster system of therapeutics is homeopathy. For the beginners, usually we used to face this type of cases and we become puzzled what to do. This will inspire throughout their life that yes, we can fight out this complaint. One more thing I want to add, that the sayings that homeopathy is slow is completely wrong. As Dr. Arijit Chowdhury was telling, completely wrong in the sense we have been tested that action of homeopathic medicine is very faster in the case of acute disease and obviously slow for only chronic diseases where the disease process is very slow with fundamental causes. Deep-rooted disease with a lengthy period of suffering, of course, it will take proportionate time. That is why usually people unknowingly said that homeopathy takes time. I can tell you to taste it. In a case of aconite napellus, you give a proper case, you will see improvement within few minutes. Not even 10-15 minutes you have to wait. Taste it. Arsenic album in acute condition. It will take few minutes only. If you put any conventional system of medicine on tongue, the absorption, it will go to the stomach, then it will be absorbed through the system, blood, then that will go to the target organ of sickness, then the medicine will start working. But what we have seen in homeopathy, if you give single globules or a drop of medicine on tongue, you just count down the time. No matter of absorption, no matter of deglutition, no matter of going to the stomach. Since that moment medicine start working, we do not know through what pathway, whether neural or hematological or lymphatic system, but we have seen it. I will give you two examples. There are many examples. Prior to that, I should request Arijit that you are having number of cases. I think we will be waiting for you to see all the cases to be inspired. I will tell you how faster homeopathy medicine can work. I was in a homeopathic family, means his father was doctor, and that son was also studying in Pratap Memorial Homeopathic Medical College, DHMS. Suddenly one day, he started, I was there at their home for some other purpose. He started respiratory trouble. He has cough and cold, obviously, but never experienced respiratory distress. Then within a very short time, the distress became such a manner that it was almost status asthmaticus. Immediately he should be transferred to hospital. Then the senior doctor, he told me, can you do anything? We will not do anything. My son have to be hospitalized. Then what I found, that the patient is jumping from one bed to other to get relief of his distress. And eyes are coming out, perspiring, tremendous dyspnea. I heard the CPR patient runs during distress, but I have not seen this type of jumping from one bed to other bed to get relief. But he is not getting that much relief. I told him, doctor, can you try with Rastox? Cough and cold, this type of distress with a very short time, and to such an extent that he cannot but to jump, not only moving and sitting, jumping and falling down on the bed from one to other, this room to that room. It's unbelievable that he was given Rastox 30. Unbelievable what I'm telling. The moment we started studying books after giving Rastox, patient started improving gradually. This jumping stops. Gradually he became able to sit down and dyspnea continued. And you'll be astonished to know within very short period, within 1.5 hours, patient become completely free. This is one case of a student homeopathy, whose father is doctor. Now one case for me, I am telling, probably I have told you this case. One day at midnight at about 2 a.m., I started coughing, dry teasing cough. I could not lie on the bed. I had to run out from the room because others should not be disturbed. But cough was starting going to such an extent that it became unbearable for me. Perspiring, non-stop cough, dry, nothing coming out. Then I thought that I should call my daughters and wife to do something at this midnight. And I was sure that I should be, either I should die with this cough if I am not being hospitalized immediately. I was not able to call a doctor or ambulance such a condition. Then, incidentally, I was moving on the floor. Then suddenly I saw my face on the mirror that I am looking like tremendous, furious condition. Here's a steady, rather rough hairs, ugly face. And my appearance was just such an ugly that as if I have become angry or become fed up with all system, all processes. Immediately I was going to call my daughters. Before that I took number of medicines. Nothing could give me relief. Some remains to other acodite, etc. But by seeing my face, I took chamomilla 6 one dose. You will not be able to believe that by taking chamomilla, I was going to call my daughters. When I was calling my daughter, I was feeling a little bit fresh, cough come down. Within 15 to 20 minutes, cough became more than half relief. When I got completely relief of this cough, unknown cough, after half an hour, I called my daughters and told the facts. There are many examples. I have heard, I have seen that homeopathic medicines are so fast to work that it does not needs to reach up to the stomach and absorption by the system. But from instant giving on the tongue or the skin, on the conjunctiva, I have also heard by inhalation only. I am having one experience. One patient has very much hypersensitive to all the medicine, homeopathy medicine. Whatever medicine I am giving, complaints are not coming down, but he is not able to tolerate. He is not able to take the medicine. Then what I did, I asked him to take inhalation. Simply open the mouth of the bottle and inhale for at least once. It is astonishing. Simply by inhalation from the nasal mucosa, it started working, and that sensitivity, allergic sensitivity, all the drugs completely vanished after giving this inhalation of carbovage. So this is homeopathy. So faster the action. But in cases of chronic or subacute disease, proportionate time have to be taken. Dr. Chowdhury has shown different types of cases. One operative case, at least it will take 15 days, operation, antibiotic, dressing, etc., much before homeopathy is curing the complaints. So, brothers and sisters, we should be very much happy that we are dealing with a system which is fastest in action in appropriate cases. So, anyway, Madam has come, Ompriya. I am requesting him to say a few things regarding his experience.
Thank you, sir. Pranam, sir.
Pranam.
Sir, with begging the pardon, I am here just to say a few words because a lot many technical glitches are there that continued since evening. But I am really feeling fortunate that after a long time, and though just listening and watching the other CMEs, this time I am here with a bit of difficulty of cough cold and all these things. The thing is that what our most respected Dr. Arijit Pal Chowdhury, she described regarding the today's topic, acute disease in theory and practice. Yes, the whole topic that he described in a very vivid manner, and the lot many cases he has shown, and definitely he has lot many in his bags to show more, but because of the time constraint, but whatever the cases he has shown, that really is highly encouraging and gives all of us a very feel good effect that yes, we all can do this. And I hope whoever is here and whoever is going to listen afterwards, watch this recorded video, we all have many more successful cases, many more miracles that has happened, many more cases that is going on the floor, and there are a lot many more failures also. And these are all the part of life, part of treatment, part of any pathy. So whatever may be the pathy, whoever may be the doctor, that matters little. Actually, the thing is that there are pros and there are cons, there are successes and there are failures. So only by showcasing our success, it doesn't always mean to take it the take home message that yes, कोई भी केस हम हाथ में लेंगे and it will be just like a miracle. No, this is not the thing. The thing that seems to be miraculous, that requires a lot many studies and efforts by the physician with a very sincere effort and case perceiving. What our most respected Dr. L.M. Khan sir during our MD period always insist us to tell that do the case perceiving, don't see the case, perceive the case. So case perceiving is highly essential, and that case perceiving for long by physician ultimately gives this outcome that by seeing the case only by prescription of arnica, that is not a thing. Arnica by the common man prescription, layman prescription, and arnica by Dr. Arijit Pal Chowdhury's prescription, there are lot many changes. Because what arnica Dr. Chowdhury has perceived, that is very much different from than the layman who is using the arnica only by the injury, anywhere injury, apply arnica, apply calendula, put ointment, put mother tinctures, and whatever it may be. So the thing is very different than the layman use and than the physicians use. For the physicians like all of us, we need lot many things starting from the theory, then to the clinical practice, and then ultimately applying on the patients. And then the outcome is the miraculous result. And definitely lot many failures, which each and every day lead us to inspire and to instigate that yes, there are lot many things to explore, to read, and to study. So what Dr. Arijit Pal Chowdhury has already told, that gives us the very clear-cut classification of the acute diseases in a very detailed manner. And also he has given what the quote he particularly told, the further back we look, the further forward we can. Yes, that is always the fundamental of each and every study. So without knowing the back, without knowing the history, we cannot move forward. So, but what is my main motto? With a great thanks to today's organizer and Dr. Today's speaker and today's inaugurator, I would like to just put one point from my side. This is just a request to my fraternity, including me, that yes, the study there, starting from the anatomy up to the last practice of medicine, and starting from organ and material, repertory, and pharmacy. So, studies are there, clinical practices are there, but anything, any science, if that has to grow and that has to sustain, that needs a deeper level of research. And what I personally think and what I personally feel, that doesn't always depend on only the clinicians or only the academicians. Rather, it depends, along with that, it depends additionally much more on the researchers. So yes, clinical research is different, and the typical research, whatever is being done by the clinicians or the academicians, is different. But we have, and each and every pathy have their research unit. We also are having very proud that we have our CCRH. But the thing that one request and yes, one point to think by all of us, that the research that we are now being conducted or conducting since the inception of not inception, since last few years, if I can tell, that this RCT that we are doing, that RCT is no, this randomized control trial, this what to tell, the single blind, the double blind method, whatever is going on, that is not following our fundamental principles. Wherever that is actually the conventional, the allopathic mode of treatment, or whatever the other mode of treatment, they may follow it. But for our fundamental principles to be followed and to continue with the principles of keeping the fundamentals untouched. Otherwise, there is no homeopathicity. If we are going to lose our fundamental principles, if we are questioning our individualization, then that research is ultimately in one in the common path, that we are one among the lakhs. We are not the individuals. We are not the homeopaths. We are the homeopaths are the individuals. So we have to keep our individualization by also maintaining a proper protocol of the homeopathic research. And this is nothing, any criticism to anyone, because I also belong to the whole stream. The thing is that a request that each and everyone, all of us, हम लोग को थोड़ा सा चिंतन, मनन, मंथन करना होगा, so that we should have the churning of the thoughts of all the things, that how to develop a better research protocol for carry forward the homeopathy researches without compromising its fundamental principles. Because RCTs, personally, I have lot many questions regarding this, and I am not satisfied with the fundamental procedures that is going on now. The everywhere the RCTs are going on, RCTs are going on. But please let us think and rethink about it, and if required, let us have more discussions on it to develop a more suitable research protocol for homeopathy, maintaining its individualization of homeopathicity, so that whatever the case may be, whatever the cases Dr. Arijit Pal Chowdhury narrated, that may be the tarsal cyst, or that may be the acute episcleritis, or that may be the infective gingivitis, or even the traumatic hematoma of the face, whatever may be the case. And personally, I have few also. Personally, you all have lot many cases, but that all require deep more research to establish that how it happens. Even Arnika cured, how it happens. What is the things that help to clear? There are lot many injury medicines. Why only Arnika? Why Natromycin doesn't help in this case? So we can think of in all that way. And yes, with all the thanks, I would again like to thank all our viewers for their patience hearing till this late night. And to Kalyani sir, my pranam, Bidyut, my pranam, and thanks to our speaker and my inaugurator. Thank you, sir.
Bidyut have become muted.
I guess he is unable to listen because of his slow movement. I can think he is facing some
Network,
technical issues.
some technical issue.
If possible, just rejoin. If possible, just rejoin. Rejoin once again. So Kalyani sir, you just do the conclusion speech until then,
Okay.
until he arrives.
Thank you, Ako. Really, today's CME, I told you, an asset for the beginners. Ompriya's advice is also very much appropriate. We are not thinking being homeopaths. We are thinking being popularized, common, traditional researchers. That should not be in homeopathy. Anyway, many thanks to Siddhartha Pal for his inauguration, and we will be waiting for your experiences in near future, dear CMA. Thank you all. Bidyut have joined. Bidyut. Still he's muted from some network problem. Okay.
I guess it's not the network problem right now. If possible, it's with the that this issue. So basically, he's just telling good night to all.
Okay. Good night to all of you, and we'll meet
Good night.
again.
Thank you, Varka, and thank you all.
Many thanks to all of you.
Thank you.
Thank you. Thank you.
Thank you all. Thanks for watching. I hope you have enjoyed today's CME. And if you have enjoyed today's CME, do make sure to give it a like, share it with your fellow friends and fellow teachers and fellow alumnus, whosoever are watching right now. And also, don't forget to take your auto participation certificate. The link is in the description, and it will be live till 11:59 p.m. So grab it up as soon as possible, and also join our WhatsApp channel to get updates as soon as we schedule. Or you can just do one thing: click on the subscribe button, then click on all notification button, the bell icon. Just click on that and click on all notification item. So whenever we schedule, you just get the pop-up updates in your notification bar. So without wasting any more time, and okay, so we are going to the beginning again. um Sorry. So thank you all again. Thanks for watching. It's a very good night to everyone. It was a nice seeing me. It's me, Dr. Orko Mukherjee, with you. See you now next CME. Bye. Good night.
This channel does not promote or encourage any illegal activities. All contents provided by this channel is meant for educational purpose only.